I will say that we know that acute pain is not the same as chronic pain. The only thing that acute and chronic pain have in common is the word pain. Acute pain stops at the injury, there's transient activation of the nociceptors, and when the tissue heals, when the stimulus goes away, the pain goes away, and the need for any kind of intervention goes away. If that's all we had, I wouldn't be here to talk about this. The real issue is what happens when the pain doesn't go away. And there's a whole series of things that happen that turn really the process of chronic pain into a separate disease process. And that occurs with sustained currents. So my back, did I mention that my back hurts? So there are nerves that are being chronically compressed in my lumbar spine that cause transmission of a signal that goes up my spinal column and hits my thalamus. And the way this has been described is it's actually, the stimulus might even be gone. You guys know about phantom pain. You cut somebody's leg off, they still have pain in their leg. That's not because of something going on in the leg. It's something going on inside the thalamus and inside the somatosensory cortex and inside the frontal cortex. So there's an encoding almost, like a memory that's, that's trapped inside the central part of the brain that has nothing to do with peripheral pain. Over time, there is a sensitization of those peripheral nerve fibers, so it takes less to make them fire. Because of sustained activation, there's structural remodeling or changes in our brain, which is plastic. That's the phenomenon of neuroplasticity. We're learning a lot about that. And there's actual tissue loss. I mean, we can measure brain tissue loss as a result of chronic pain. We also know that chronic stress of pain enhances the signal from the hypothalamus and the pituitary axis, the sympathetic nervous system discharges, and the last thing that we're aware that happens is that the way in which we inhibit unnecessary pain that I talked about, that analgesia of the chase, that's inhibited in people who have chronic pain. So serotonin, norepinephrine travel down the spinal column, inhibit pain. That is diminished. The ability to diminish unnecessary pain is impaired in people who have chronic pain. So the net effect is we have this wind-up phenomenon, which is really what it's called, in the spinal column and in the brain, and there's an escalation of the experience of pain that doesn't serve the person. That's really the key. Chronic pain, what good is my back pain doing me, except something to talk about?